Hello my dear subscriber and viewers, welcome back to Akshara Akshita 2023 channel. In this video I am going to explain about second element from the MDM. So first element from the out of three element, first element problem I completed in the last video. Those who are not watched, please watch last video. So in this video I am going to explain in second element, that is amount or complexity of data to be reviewed and analyzed. So first element is problem, second element is data, and third element is risk. So based on three element only we have to choose the MDM final level. Okay, so before choosing the final level, either it is straightforward, low, moderate, high complexity of MDM, we need to check the three elements. From this three element only we can choose the final table. So first element will be problem. That problem considered as four category: minimal, low, moderate, high. And now in this video I am going to explain about data to be reviewed. Those who are not subscribed my channel, please subscribe my channel, press the bell button, then only you will get my future videos as a notifications. Okay, let's start amount and complexity of data to be reviewed and analyzed. So one element used in the selection of, as I told you already, from this element selecting the level of the amount and complexity of data to be reviewed at the encounter. Okay. So here also some terms we need to know definition of the some terms. What is the analyzed? What is the test? What is the unique? What is the combination of data element? External. What is the discussion? What is the meaning of independent historians? So these terms only we are going to check in the element of the data to be reviewed. So these terms I will explain you in last. So please watch until the end. Okay. The first is in this level also we have four types. One is minimal, low, moderate, and high. So in problem also same four types: minimal, low, moderate, high. So in this amount also amount or complexity of data also four types: minimal, low, moderate, high. Okay. Then to consider what is the minimal, what is the low, moderate, so based on these three category only we need to choose the whether it is minimal, low, moderate, or high. So the first category is test record historian. The second category is independent interpretation. Third category is discussions of test. Based on these categories only we have to consider either it is minimal, low, or moderate, or high level of the data. Okay, so this is the table. What is the minimal means what will be there in the medical record. Low means what we have to consider, like problem we already saw. For minimal means self-limited. If self-limited problem means we have to consider as a minimal. Like that for data also some points they have given. If that point is matching means we need to consider what is the level, what is the type, either it is low or minimal. Okay, let's see one by one. For minimal, no need to review anything, no need to do any order, any test. So none. If none means that will be minimal. Okay. Sorry. For low, so there are two category they have given. Out of these two category, one category should match to consider as low type of data. Okay. So minimal, none. For low, there are two category. For out of two category, one category should match to consider as low level. So category 1 they have given 3 point. Out of these 3 point, any of 2 points should match. Then only we can consider as category 1. Okay. So totally two category. Each category they have given some points. that point should match from our medical record. Okay, so category 1 test document, from this test document at least two of the following should match. The first point is review of prior external notes from each unique source, and second point is review of the result of each unique test. Third point is ordering of each unique test. Okay, so this is the category 1. From this 3 point, if any 2 point is matching from our record, then we can consider as category 1. Okay, or category 2 if we have in our medical record, then we can go with it a category 2 point. What is the category 2 point? Assessment recurring and independent historian. So assessment recurring and independent historian is there in our medical record, but category is not there in our medical record, means we can go with the category 2. So category 2 independent historian means low level we can consider. Out of these two category, any one should match to consider as low level. Okay, minimal completed, low also finished. For low level there are two category. Out of two category, one category should match to consider as low level. Next is moderate. For moderate, they have given three category. Out of three category, one category should match. So each category they have given some point. So those points should match to consider as particular category. Okay, so let's see first category. First category, test document or independent historian. Any of these 3 point, not 4 point, it should match 3 point. So already they have given 4 point to consider as category 1. So in the out of 4 point, 3 points should match to consider as category 1. What are those points? The first point is review of prior external notes from each unique source. Second point is review of result of each unique test. Third point is ordering of each unique test. Fourth point is assessment recurring and independent historian. Or this is the category 1. What is the category 2? Category 2 means independent interpretation of test. That is independent interpretation of test performed by another physician or other healthcare professional. Those professional services should not report separately, then only that services we can consider as counting of the element. Okay, so independent interpretation of test means category 2. What is the category 3? Discussion of management of test or test interpretation. So discussion with whom? Discussion of management of interpretation with the external physician or other qualified healthcare physician or appropriate source. So this point is discussions. Discussion is category 3. Independent interpretation of test is category 2. Combination of four points is category 1. So to consider as moderate level, they have given 3 category. Out of 3 category should match only one category. Okay, each category they have given the points. It should match all points to consider as particular category. Finally, high. For high level, they have given 3 category. Out of 3 category, at least 2 categories should match out of the 3 category. So for moderate, out of the 3 category, 1 category should match. But high level, out of 3 category, 2 categories should match to consider as high level. Category 1, test document or independent historian. Any combination of following 3 points should match. So how many points they have given? 4 points they have given. So within this 4 point, it should match 3 points. So the first point is review of result of each unique test, ordering of each unique test, ordering of each assessment of recurring and independent historian. Then category 2, independent interpretation of test. So independent interpretation of test performed by another physician or other qualified healthcare professional, but it should not be separately reportable. Okay, this is category 2. Category 3 is discussions. So any of these three category, it should match two category to consider as high level. Okay, that's all about the data points, but you should know what is the meaning of unique test, what is the meaning of independent historian, what is the meaning of external physician, appropriate source, what is the test. So if you know the meaning of these terms, then only you can check the medical report, what is the high level, what is the moderate, how we can consider as a low level. So the terms you should know. These terms, all terms, they are in our CPT book also available. So if you don't have CPT book, I will share you the link in the description box. Please check the link. On PDF will be there. So only the ENM part. So if you search in the Google also, you will get the PDF from the AMA, released by AMA. Okay. So I will share the link audit tool also. For in audit tools, in one page they have given the elements, all elements, MDM table, and ENM PDF link I will share you in the description box. Then my blog also. In my blog I will post my ENM notes later, maybe in the next week. So when it is ready, please regularly check my blogs for notes. Okay. So let's see the terms separately, the meaning of the terms. What is the meaning of order? The test may be normally be performed, but after shared decision making, the test is not ordered due to the risk or necessity. So these tests may be still be counted, but consideration must be documented. Ordering test and reviewing of the result as part of the encounter. Okay, so it is included in the category of test result. So order means the test is not performed, just only the ordering. That is the meaning of the order. Okay. What is the test? The tests are any imaging or any laboratory or psychometric or physiological data. That is called as test. So clinical laboratory panel, example basic metabolic panel, CPT code is 80047, is a single test. So differentiated between single or multiple tests is defined in accordance with the CPT code set. So for purpose of the data reviewed and analyzed, pulse oximetry is not the test. So pulse oximetry we cannot consider as a test. Okay, then what is the analyzed? Analyzed means test performed, test ordered, and that test also performed, and the test result also came and result also reported. That is considered as analyzed. For an example, if the test is recurring, the test is counted when the result is reported and not when it is ordered. Ordering a test may be included those that were considered but not performed after the shared decision making. Okay, so analyzed, this is the meaning of analyzed. Then what is the unique test? So we saw in the tabular column, no, MDM tables, unique test. That what is the meaning of unique test? Unique tests do not include overlapping elements and are defined by the CPT code sets. The multiple result of one unique test. So multiple laboratory test included in the one unique CPT code is considered as unique test. So for example, unique source is what is any panel. So in that panel, so many tests will be included. CPT code will be included in the one set of CPT code. So that will be the unique test. Okay. Then what is a unique source? Unique source is a clinician in one group or different specialty or unique entity. Reviewing of all materials from the unique source count towards one element of data in MDM. Okay. Then what is the independent historian? Independent historian, when patient can unable to provide complete history, that time patient's family or patient guardian or those people will provide the patient's complete history to the physician. So that will be considered as independent historian. Okay, independent historian means patient is unable, when patient is unable to provide his history to the physician, that time any patient caregiver or patient's family members or any guardian will provide the patient's complete history to the physicians. That will be considered as independent historian. Okay. Then what is the discussion? Discussion records an interactive exchange regarding patient report to discussion with the whom, discussion with any physician or what, to whom they are discussing patient's report. So that we need to know the what is the discussions. The exchange must be direct or not through the intermediate like clinical staff or trainees. So if the discussion is given by the trainees or clinical staff, we cannot consider. So discussion, sending the charts note exchange will be by the physician. Okay, any discussion does not need to be and date of encounter, but it counted only once and only when it is used in the decision making encounter. So it may be asynchronous. That does not need to be in person, but it must be initiated or complete within short time period. So within a day or two. So it should not be discussion in the same encounter, but it may be in within 2 days or within a day. The discussion must be happen to the regarding the physician's report. Okay. So what is the independent interpretations? So independent interpretation is interpretation of test for which there is a CPT code, and interpretation of reported is customary. This does not apply when the physician care professional who reports E&M services reported or has previously reported test. The form of interpretation should be documented but need not conform to usual standard of the complete report for the test. So independent interpretation, doctor has to report for the particular CPT interpretation is there. So the service also we have built separately for interpretation CPT code. We cannot counted in the elements of the data. Okay. And what is the appropriate source? So discussion, in the discussion point we saw no discussion with the appropriate source. What is the appropriate source? Appropriate source means any discussion with the discussion with the appropriate source. Appropriate source means any of teacher or lawyer or any third party that will be considered as appropriate source. Okay. Okay, that's all about the data. So second element we completed in this video. If you have any doubt, please comment. And so based on this 4 category, minimal, low, moderate, high. So based on this categories points, what is the types we have selected. So though that elements we need to put in the final table to select the straight, low, moderate or high complexity. So for that only we are completing each elements in each video. So first element problem is completed in first video. Second element this video data completed. So in next video we are going to see risk, that is final element. So if we completed final elements, then we can check the how the final table will be, MDM table, how we can calculate based on this 4 types of categories. Okay. So if you have any doubt, please comment, and if you like this video, please like and share to your friends also. Don't forget to subscribe my channel. So in next video let's see risk, E&M part 3, risk of mortality. Okay, thanks for watching my video. Thank you so much. Bye bye.